Hi, I'm attorney Bob Marcus.
And I'm attorney Brian Mitterheiser.
If you've been hurt in an accident, you need an experienced team of attorneys, and that's Marcus and Mack.
For nearly 50 years, we've helped clients obtain financial compensation for their losses, and our firm is dedicated to doing what is right and whatever it takes.
If you've been hurt in an accident, tell them you mean business and call Marcus and Mack.
Voted Best Personal Injury Lawyer 2 straight years in the Best of Indiana County contest. Visit them online at marcusandmack.com.
Rev up the excitement at Luther Ford Lincoln's Auto Show celebration. It's all about zero. For a limited time only, get 0% APR for 60 months on the rugged Bronco Sport, the versatile Ford Edge, and the sleek Ford Escape. Plus, during Ford Truck Month, there's 1.9% APR on the powerful F-150 XLT Crew Cab 4x4. Luther Ford has the wheels and the financing deals to get you into your dream ride today. Visit Indiana County's Ford experts, Luther Ford, Route 119, Homer City.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. And Dr. Dan Clark is in the studio with us this morning. Our conversation brought to you by Marcus and Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus and Mack, a law firm representing injured people. IRMC has big-time game when it comes to its breast cancer center and breast cancer treatment and diagnosis, and that was affirmed this week with another new accreditation. Dr. Clark, good morning to you.
Good morning.
This is a big deal, isn't it?
It is. It's a very big deal. As you may recall, we were the first center in all of Western PA, Central and Western PA, to become nationally certified for our breast program. Mm-hmm. And now, as of this year, we are the first program to be recertified, and we just received another 3-year full recertification from the NAPBC, the National Accreditation Program for Breast Centers.
Yeah. This is not just, okay, you did okay, we're not hearing anything bad, so here's your rubber stamp. They really put you through a vigorous test, don't they?
They do. Actually, I felt it was more vigorous this time than our first time around.
Oh, yeah.
And, you know, the NAPBC is a organization under the American College of Surgeons Commission on Cancer. And they're the same programs that certify cancer programs throughout the region. Mm-hmm. And we're also a certified cancer program as well. But with the NAPBC, we have to maintain the standards and improve on them. It's not just that we can rest on our laurels. We meet periodically throughout the year several times. Our leadership committee meets, which is, I'm the director of that, but it also includes medical and radiation oncology, pathology, radiology, and administration and various others, dietary, social work, physical therapy, and everything else. And we have to come up with quality improvement programs every year, 3 of them. And they have to be significant. They're not just that we can say, okay, we're going to do minor things and monitor them. We have to actually show significant improvements. And even though we're nationally certified, we're meeting or beating all the national standards, we have to improve on that every year.
Yeah, and well, a part of that is that that planning process has to begin very, very early. I would assume that for the next accreditation, you're already thinking about new ideas, what directions to go, because change doesn't happen, improvement doesn't happen in a week. It takes planning and then execution.
Absolutely. We are already planning because the standards change. You know, the standards across the country change, and standards improve. And as we learn more about breast disease and breast cancer, the standards change, and we have to change and improve along with it. So we are already making changes, you know, based on the changes to the standards, and that we're looking at the next 3 years, mm-hmm. so that when we come in, it's not going to be a rush or anything like that. It's just going to be like, okay, we're ready.
Do people notice, patients notice, families notice what those improvements are, what the changes are?
A lot of them do, because, you know, when I first came here now 5.5 years ago, you know, one of the requirements for me to be recruited here was I said, you really have to up the game in breast care. And I've said this before, it was very easy for me to walk in here as the director and get this to be nationally standard, because they had everything in place already with a few minor things that were missing. Mm-hmm. And I had 100% backing by the administration, and it was just, you tell us what we need to do. We want to be the center of excellence for breast care. You tell us what we need to do, and we're going to do it. And I haven't had that kind of just ultimate support anywhere else I've been. And I've been several places, and I've been chair of cancer committees at several large systems. And here I walked in, and it was, you just tell us and we're going to do it.
Yeah. When we think about noticeable changes or noticeable improvements, obviously the new 3D mammography available at the Northern Cambria Clinic is a big part of that.
Right. Yeah, we opened that up last year in the middle of the year. And now we have 3D mammography up in Northern Cambria. And also Dr. Bill Moria, our other breast surgeon, goes up there and sees patients as well. So it's not just that you can get your mammogram up there. Dr. Bill Moria will also even see breast patients up there as well.
Yeah. And the addition of Dr. Margaret Clark for breast cancer radiology is extremely important too.
Right. We now have a dedicated breast radiologist. She was the first breast radiologist in Westmoreland County when we arrived in 2002. And she helped develop the entire breast radiology program there. And it took me a little bit to get her convinced to leave her baby that she developed down there and come up here. But now we have her, and our access to biopsies and our access to diagnostic studies and everything has just improved dramatically, because now we have a dedicated breast radiologist. That's all she does is women's imaging.
So a half a decade of your work here in Indiana County and with IRMC, and not just Indiana County, but the entire region, and the breast cancer treatment programs, the breast cancer diagnosis program, which really are two different things.
Right.
They walk right along with the overall advances in breast cancer, breast care across the United States. It must feel pretty good for you to know that IRMC is right there with the lead pack in making all this happen.
It does feel really good. And to tout my own horn a little bit, is one of the things that the reviewer said this past time is our genetics program was outstanding. And, of course, I'm the one who does the genetics program, and it's close and dear to my heart, because I think, and the American Society of Breast Surgeons feels, that we're under-testing for genetics and that there's a lot more genetic disease out there and that we're not picking up. And now, as we'll be talking about next month, that's become very prominent with colon cancer as well. And I do the colon cancer genetics as well. But when I first started doing genetic testing 14 years ago, we were just checking BRCA1 and BRCA2 for breasts. Now we know that there's 10 different breast cancer genes, and I say in 10 more years, we'll be checking 100 different breast cancer genes, because the genetics program has exploded. Unfortunately, I have a big wait list for that because of the need now for that. The other thing that we're really doing, I'm very proud of, both Dr. Bill Moria and I do a high-risk screening program. If you come into me for genetics and your genetics are negative, I still look at all your risk factors, and then we can do a thing called a Tyrer-Cuzick breast cancer lifetime risk estimate and calculate your risk estimate for your life up to age 80 of getting breast cancer. And we may make recommendations for additional screenings, be that, breast MRIs and mammograms in addition.
Yeah. With this and the ability to diagnose earlier and earlier in the whole breast cancer journey that someone may have to go through, the predictive ability that you now have, how does that change the way that you monitor and then treat breast cancer? If you can catch it earlier, I'm assuming that it's a whole different protocol than when you've caught a breast cancer diagnosis later in the process.
Yeah, it's a huge difference. If we catch it early, our survival and cure rate are very high, 95% at 10 years, if we catch early breast cancer. But the survival and the outcomes go down as the stage goes up, and that stage is how it progresses. Unfortunately, some breast cancers, even at early stage or early diagnosis, are a later stage. However, we have made such great advances in the treatment of breast cancer because of all the publicity and the money that has gone into research of breast cancer, that what used to be a death sentence with breast cancer is no longer. One of the worst ones that comes to mind is triple-negative breast cancer. 10 years ago, when somebody got that diagnosis, I would hang my head, and it would be upsetting for them, for me, because I felt frustrated because it didn't matter if we did surgery first or chemo first. A lot of the outcomes weren't good. Now we've reversed that, and we know that if you have triple-negative breast cancer, for the most part, we do chemo up front, and the surgery is later, because surgery only treats local disease, and the chemo treats your whole body. And nobody wants to hear they have to have chemo, But we have millions of survivors now because of the advances in chemotherapy and treatment. And now with the immunotherapy that's out there, we've had other leaps and bounds. And if somebody has a genetic disease mutation for breast cancer, there's another type of specific targeted therapy called a PARP inhibitor that can be utilized. So we've just the knowledge and the treatment has expanded dramatically, and we've made such great advances in the treatment of breast cancer.
I recall when we did Breast Cancer Awareness Month in October that there's actually a movement to change that term chemotherapy because it's gotten such a negative reputation, unnecessarily so, but maybe we think of it in a more positive light if we reterm it, because the medicines change all the time, and really chemo, when you say chemo, you're just talking medicines.
Right. An aspirin is chemo.
Yeah.
And I always say, the FDA probably wouldn't approve aspirin in this day because of all the side effects can be associated with aspirin. Mm-hmm. Anything you put in your body is chemo. A vitamin is chemo. So chemotherapy is just medical therapy. And that's really what I would like to see it termed as medical therapy, because it is a whole host. There is still some very aggressive chemotherapy out there, but it's used less and less frequently because we have far more targeted therapies now. We have far more effective therapies now. And also they can pre-treat for those potential side effects before the treatment is given. And that really cuts down on everything. It still happens, but it's pretty rare that we see a patient having to get admitted to the hospital because of complications from chemo. Mm-hmm. 15 years ago, we had a floor dedicated to medical oncology because the chemo side effects were so bad that people were admitted all the time because of chemo. We rarely see a patient in the hospital anymore because of chemo problems.
New accreditation for IRMC in the breast cancer program, that being the case, there's going to be obviously the need to get that information out, to market that so that women have the hope that they should be having when it comes to breast cancer. And breast cancer diagnosis is where it all begins, and this accreditation helps that tremendously, doesn't it?
Absolutely. I mean, this should show the community that you don't need to go anywhere to have nationally accredited breast care. We have to meet or beat the national standards for cancer care in breast. And that also means taking care of non-cancerous disease of the breast as well. Mm-hmm. So we meet all those criteria and we exceed all those criteria. And like I said, everybody here has been so dedicated to it. The other thing that we just upgraded our MRI. When I first was coming here, there was no breast MRI. So the breast MRI was installed January after I arrived. Now, 5 years later, we have a brand new breast MRI. A brand new MRI for the entire system, which is fantastic because we use it for rectal cancers and things like that. But we have a brand new breast coil, brand new breast MRI. So once again, 5 years later, they've upgraded the game in breast MRI as well here. And so that's the commitment to excellence in the treatment of breast cancer that is right here that you won't find in a lot of places. There are only 4 centers in Western PA that have the national accreditation. We were the first, and now we're the first to be re-accredited as well.
Breast care at IRMC, again, is a leader. So what's it say to you, ladies? It says, get your mammogram.
Absolutely.
Women's Imaging Center, IRMC at Chestnut Ridge, Northern Cambria. There are 3 locations to get that mammogram. You got to get that done.
Absolutely. That's the start. Mammogram has been shown to save more lives than anything else out there. Women ask me, can I get an ultrasound instead? Can you get an MRI instead? And the answer is no. Everything else supplements mammogram. Mammogram detects far more cancers than any other study out there. It's not perfect, and there's more dense breasts. It decreases the sensitivity. 3D is better than the digital, and which was better than the plain film that we used to have. And there's new things on the horizon. There's contrast-enhanced mammograms that are coming out that may even prove it further. But mammogram is the #1 study that has improved survival throughout the country and the world as far as breast cancer is concerned.
He is Dr. Dan Clark. Thanks for coming in to visit with us. Appreciate that very much.
Always a pleasure.
It is the voice of Indiana County, WCCS 101.1 FM, AM 1160, WCCSradio.com. Now, we're in Heart Month now, and it is Colon Cancer Awareness Month right after that.
That's right.
And so we're going to have you back and folks from IRMC all next month to talk about that, because that's something that is the IRMC is leading in that arena as well.
Right. Little sneak peek, we're going to have a visiting robot for colon cancer month as well.
Oh, really?
We'll have the opportunity for the public to come out and see the surgical robot.
Nice, nice. It's Indiana in the Morning. It's WCCS. Jake is in the newsroom. He's coming up.
This is Bart Winkler with a CBS Sports Minute. The mystery of why Justin Fields unfollowed the Bears on Instagram has been solved. Talking on the St. Brown Brothers podcast, Fields says he's taking a mental break from football and is not interested in seeing all the draft content. So will he ever follow the Bears again? Probably not. I think the Bears make the trade with Atlanta. Fields then follows the Falcons on IG, and the Bears get a new follower in Caleb Williams. I'm Bart Winkler.
Texting enrolls you in a recurring automated marketing text messages. Consent not required to purchase. Message and data rates may apply.
The team's looking good this season.
I think so. Man, I miss playing football. Being young with unlimited energy to burn ever since I turned 40. I just can't find that fire I used to have.
Think it could be lower testosterone?
What do you mean?
All guys lose their edge when they turn 40. The body has less testosterone. That's why I take Nugenix Total T.
I've heard about Nugenix. That really works?
Since I started taking Nugenix, I'm lifting like when we played for Coach Carter. I feel more energized at work. It's even spiced up things between me and the missus.
Are they still giving out complimentary bottles for people to try?
Yep, send a text. It's that easy.
Text JUDGE to 42424 right now for your complimentary bottle of Nugenix Total T.